In this 5-minute talk, I'd like to emphasize the importance of precise ablation for the best outcomes of hepatic ablation. Although the planning is most important, successful ablation depends on how much accurately one operator performs the procedure according to the plan. As we all know, the devils are in the details. Accurate placement of electrode is critical to achieve accurate ablation. Any powerful device cannot guarantee successful ablation if we miss the accurate placement of the applicator. Punctual placement of applicator has been underestimated so far, a kind of undervalued stock. As you can see, the plan and the reality usually shows a different story in many of our cases. However, the difference between plan and the real procedure can be minimized by accurate performed procedure. I think it is necessary to consider the tumor three-dimensionally for accurate placement of the electrode. If we plan to ablate with single ablation for a smaller tumor, we should insert along the central axis of tumor as much carefully as we can. For accurate placement, please take your time. Slow insertion may be better than just a quick love insertion. For accurate ablation, we don't need to such a nice car, Ferrari. School bus may provide more benefits to accurately place the electrode through or around the index tumor. Please remember there are 3 bus stops ahead along the electrode path. The first stop in front of tumor. The second stop at the central core of electrode of the tumor. Third stop beyond the posterior margin of the tumor. We should stop at each point and check whether the electrode is accurately placed along the central axis of tumor at different planes by rotating the ultrasound probe. If you are sure, move to the next point. Even if the electrode is placed off the central axis after inserting up to the third point, just leave it there and don't try to reposition. Just check the direction of eccentricity, which will be useful to plan repositioning of the electrode after the first ablation. The reinsertion cannot guarantee the accurate insertion along the central core of the tumor, and reinsertion process before ablation can be a risk of tumor seeding along the electrode path. So, stop at 3 bus stops. Don't miss your student. Check where you are at each bus stop and adjust the direction toward the central line of the tumor. If one considers multiple ablation using multiple electrodes, optimal arrangement of each electrode needs substantial experience. But slow insertion with checking the electrode position at 3 bus stops may provide more accurate insertion of multiple electrodes. Before starting ablation, it is very important to check the tip of each electrode was placed enough posteriorly to achieve posterior ablative margin, because the electrode usually is a little bit retracted by respiration. Ask to yourself 3 times, are you sure? Are you sure? Are you sure? If your answer is surely yes, push the button. Of course, after starting ablation, You should closely monitor the ablation zone during the whole procedure. Accurate ablation is the underemphasized tip for the best outcome of ablation. Take-home message: school bus with 3 must stops. Thank you for your attention.